Ladies and gentlemen, my name is 10 Star General D Crime. It's all about Kobe Joe's Fun Blog, baby. The number one infotainment. Anything exclusive, hit the log right here. You don't need to be told. Here,
I wish you for a great day, and I have one incredible, amazing, super boss. See, my friend, he's doing extremely amazing, and when him say, "Krumha, a bear din say, obi between whom I see was say, me person me ye adi na me de boa Ghana man." This man is doing extremely amazing, and on no other Jumako we volunteers for Unia Wellness. It's an NGO. Impact focus on say to educate, to inform, and also help correct the negative narration na Ghana for nibi concerning sanitation, education, health, and other aspects. Needing ede benke dodo na friend benke ene pese ya twetwe nkomo na uhuni more dear deporte na oye ni motive ni purpose vision ena adeɛ yɛn hwɛ anim sɛ through the NGO no people of Ghana will also benefit from it. Big man, me ma kwaba.
Me jo so mini akobi Josvan.
Bibi aboko.
Me adom me ho ye pa.
Longest time.
Serious.
The last time was when you meeting for a sanitation exercise, and I think we are Juma Sononko. And just after exercise, you know, me say social media na nkofu bebre ebo aba so. Juma we no mostly mostly eyewo ana watu ho asi wo se opese yesa se wonam na wote se nkofo ebo udin benke they are the never with dream. Like, how do you feel when sometimes you see people appreciating your efforts will put it in there?
Yeah, me da seminua Kobe Josvan. Like I say, anytime I'm a number be na obi be from me be a band care and I say, oh, volunteer for new wellness for ne ba kunio ya na mitia ekese. Because I feel say we are doing something right. So I also so na nkasabe mako wiya obi ade a never kromfo I will be scared and I say me start to say me too me can am ferry into the same way as a ka ben care and I say obi hu ba bi no acknowledge the way na am also I motivate you then you know say okay the way no nipa hu na the way no so is bringing some positive impact into I think all in all it's a good feeling. It's a good feeling, and thanks to some of you who give us the platform and the spotlight. And yamwa anka sabe ebi amene mebusha for nkwa na behu de ekoso, but you gave us the platform. So I think I shared that credit with you and your platform. Yamisha will follow us and so yeah.
Painful said the food you apa and the piano into Mr. Benke ya dear Eswani na unhia say yensu be use a platform to projector and unhia say yensu be use a platform. At any point in time bia adaje wo hon kwan de na say oye adwuma bia I don't hesitate pushing and also using my platform to amplify. Now obi enim se e ka Benke a why na de Mr. Benke?
Yes, okay, so Benke Benke is a long-standing medical professional. I've been in the medical profession. I think this is my 13th year since 2012.
Nice.
So I entered through a nurse. I started as a nurse, general nurse. From there, went to study pediatric nursing, child health. Then in the school, time I'm at University of Ghana, I was still doing a program at UCC. So I was doing two universities at the same time. Now me medical imaging, sonography, scan, and then after that, I was working around. Then I went to do masters in art, assisted reproductive technology, or IVF, and those studies. So that is where I've specialized in as masters. But all along, I was doing this philanthropic work where I was doing free education on health matters and then positive values in the system. So it got to a point about 2-3 years ago, I have to start what we call knowledge is power. Okay. There's a platform, it's a WhatsApp platform. I think now we are about 400 and something.
Nice.
Into hono na me the free consulting room.
Okay.
Into hono Ubia from even we have foreign people, US, other people who are on it. I think after this I will show you that this thing. na or health issue biya, you just call me. Because I was having other doctors and other professionals there. It is a frame say obia benke problem we na me wo say na me ye ne den. Me so me advice and as a medical background in know, I'm able to tell you so yenye ni say and I fa hospital ye way. If it is not within my jurisdiction, I have other professionals and as a specialist on more platform no so I lace you to them, then they will take care of that situation. So in most cases, most of our people didn't need to go to the hospital because we have people who can just help them outright. Now it be as a drugstore be now be call no much so pay for sound area. We'll go ahead. So we're doing these free consulting room services. Then we have to move into setting up an NGO because it got to a point some of our people on the platform said, let's come together so that we can go to a location, do something. Said the also the way free, there should be my making more impact. So that is where a migrate to and a cover volunteers for Unia Wellness.
Okay, I think say you call volunteers for Unia Wellness. I mean, fields baby and Chromoha.
Yeah.
Why did you settle on health? DRD and this is where I want to finally settle at.
Okay, thank you, Josvan. So I would say, health is everything.
Okay.
Health is everything. In fact, see, I can't help it's not just about malaria, typhoid, this thing. Even we have financial health. So uniska
now.
Yes.
Me miniska na me bufu rough.
In fact, me the miniska na me run diarrhea because everything about health, us, is health.
Okay.
Do you get it? Into when you can't help is more or less a wellness. And how well your system is not just about medicine. It's about other aspects, sanitation, environmental health, good living, your diet, your financial status, your psychological status, mental health. So health is almost life. Health is life. So I settled there because I knew, and I made me have the opportunity to touch a lot of lives. Okay? Obi no ma me yare or complaints or the beba cry no beki can be no. Obe run a labs, obe scan be no. Nhwe. But on na bet na say am be din kom no say ade na ama na feelings are feeling no. It's not about para na say malaria treatment. It's more about psychological issue. Okay. It's more about ebia nisika sembi na nkoye, ebia disappointment bia baby, the expectation be he was not able to meet them. So and ama ne feel so yare because there were some symptoms bia in medicine very psychomotor it me as a and I say psychosomatic. Excuse my terms.
Oh, no,
but because
it.
of my
this
so you can't psycho na adwin.
Yes.
Somatic no here about feeling or skin. Nti obi on ma psychological issue binti otimi have a symptom that appears on the body.
I see.
So I say nti na bia obi on ma say ne bufu a na nani ayekoko.
I see.
Enya say wahye. Wakọ hyehye ana say but nani na ayekoko no is because of adrenalines be and say chemistry be akoso on the system no no. So it's the same thing. People could be in other situations any medically related, but you can see say he's not fine. Okay. So also na your environment at the end of the day ebeba affect you because if you na enam area ni mo at the end of the day and once na bi be kwa akofa if you ni bi di aba ofie or glass e bi a enjoy let's toast to so and so na and once na bi abe deposit kakra obenom 3 days 4 days 1 week time now I start running temperature. So you see, say a lot of things are interrelated. So what I say, I decided to settle there because I feel, say, my opportunity to enter every corner of human life, both psychological, physical, all other aspects, and then help man.
How difficult was it, especially Abrana Water Sherry? You combine two courses at a go. And I know how challenging it is. Sometimes, if you don't take care, ube lose focus.
Great.
One hempa.
Great.
I mean, 2 courses simple no.
Great.
You can't even focus or even had better or get good grades. Wo de no wo ye ne sen ebia obi wo ha onyan ko be ye wo de ni bi but ohun akonya on fanfa so no wo de no ye ne sen at the end of the day you were able to come out successfully and at the end of the day so bibi papa nso epiem eba
just by any member why you cool say also so oye bibisa it's not easy.
Yeah.
It's not easy. So I remember when I was running my program in the University of Ghana, and it was a regular program. I'm a war hostel at the Liman Hall. That was my hall. So your first semester we were working as professional nurses. So when you come to do the degree program, it becomes a 3-year program. So we join at level 200. Until level 200, just the first semester and I ended, I told myself, I don't want to go back after the 3 years. Not the men for other people name say or koye degree in this until you are expecting say about the certificate back in neighbor. So it means you've been predicted and you're more predicted and no one had buy. So I told myself, no, I want to rather go with extra certificates, extra knowledge, extra skill. So me to hona near run it through me and then I settled on say, okay, I want to go into sonography. Now I know I am in the clinical setup. I want to go into the diagnostics.
Okay.
So I decided as a programmer at the school that is affiliated to UCC. So it was not easy. Sometimes you have what is it, IA, and I say end of semester exams. 2 places I crash it. I remember one particular day I was writing a paper on Legon campus. Then I have to go to Tema because we're having a satellite campus with UCC4,
Okay.
The school no many friend Clintaps University. No. Now 2 papers, one here, one at the other side. Me sure Legon the anyway and I'm far Uber. A feel Legon. I rush him good and I can't 30 minutes. I'm on my way. Sa paper. Sometimes they are aware say I'm running a certain program somewhere, so that is into the corner. Invigilator and I say I can't 30 minutes. So wait me there. Go ahead. The ones you quite. And I'm saying meet me. So I jumped in. Now, massa paper on the 2 hours, which all the 30 minutes is better. But God so good. I was able to go through it, do it, and I said 30 minutes in the year, and I was lucky on my extra 15 minutes. Some fan completing them here. So studying 2 different programs, have to attend practicals, go for this, go for that. It was very stressful. And at that time, I was still doing some part-time too, because I have to get money to pay fees for all these things. So I was working, so I wasn't sleeping. I was having a very big bag. Mr. Sammy near my guma, because me one night. Saturday I call job be na whole clinic. Near private nurses. Into just can be to me for a nurse and papa man ne maame bi and to mo admit na why a private nurse to ne na be ho so na me ko twa night e wo honom na ade chama ba lectures or campus weekends me ko ha yes so it was very stressful, but the only thing I'll tell anybody watching us na they are motivating is that you see this life bibia ni ho abeka so be ya untimi nye bibia ni asase we so usi utrim se me ya untimi nye ubetimaye
nice one.
You can do it. Just determine and also focus on what you want to do. These were things 2 programs are under normal circumstances on paper. It wasn't possible for you to do them. Okay. But in reality, I was able to do it.
Nice
do you
one.
Understand?
Nice one. I think say my boss story is very inspiring, and if you're young out there still finding difficulties and challenges on certain things and always giving excuses, I'm sure say your response to all excuses, and behind every successful man there is a story. Ebia will be feeling so Charlie. Why you abrabona peke into other forms it wasn't easy. And with what you are saying, you need to be very brilliant before say you'll be able to do. Because addition easy. Yeah. Addition easy. So for you to go through successfully and finally come out, become a professional nurse, and even thinking of even advancing, adding more value to yourself. Kudos to yourself. Now, In Premier Base, you call some of our health centers now. You targeted the stories be some of the nurses need be Musubai, Moneye, ni be Shada and Shani. We are nursing. Dear, I didn't to me causes are adding.
Okay, that was it. So on this particular topic, I'm speaking as a nurse.
Yeah.
I don't practice as a nurse, but since once a nurse, always a nurse.
Yeah.
So let me use this opportunity to say, one who in every profession there are bad nuts and there are good nuts.
Okay.
However, say me ankasa will acknowledge say nursing some of the standards ni bi wo hono ma young crofo ni bi are not living to that standards.
Okay.
So I think day in day out, when we have that opportunity, we tell those we meet, they say they have to raise the standard. Because they say as a agro aba nurses ni bebre and so
TikTok abra patient that.
Good. And that is not ethical. But they say you see when wrong thing is repeated severally, it becomes like it's normal, but it's still wrong. And sometimes I blame leadership. And personally, I have personal relationship with some of the nursing leadership. I personally was taught by the General Secretary of the GRNA.
Oh, nice.
Dr. What's the name? David Tenkrine. He's my lecturer and was a body personal person, even till date. I know the good work they are doing, but you see, young Crawford are still taking things for granted. And a man nurse, and in one way or the other, as a respect, akofom. First, yes, because they say oko hospital, some of the things are nurses In fact, we say layman crowd tinchen feel say ade nipa yi kra no ono crowd ye layman no onye nurse no. You could have done better. So I say, I think we have to lift up the game and then we have to punish those that need to be punished.
Okay.
See, I was here Joe Lances, I was here G. So I was here Pamo, I was here Pamo. And as I say, training protocol, some near dear obi on my sabe ne qualification and do the standard to go and even read nursing. But now I am a back door, enough from and when somebody don't suffer to get something, it doesn't value it.
Okay.
Biara.
Okay.
So say, well, that is your field, and you are a professional. Mean to me, say meba na bia pass me through ja. Now I'll put more value on it.
Okay.
But meba na now church and buga na me de pia. Me so me kwa buga na me. So I think I was here go back to our source. Now, or more, I was here punishment. Let's punish them. Now, you enjoy say some media station be exposing us. Now, you have a general the media person. Not them. We are the power. Okay, the baba to. Into we are born and so near the better. Keep quiet and suffer.
Nice.
And now I'll also tell you people who are the bonena report it.
Oh yeah, be there was a video be a chance done. I think it's a young lady. Name of why? Because that time Namako strike and according to young lady the wife was insisting so they should take care of whatever expenses and even if there's a need for her to even compensate them, will compensate. But they ignore the man because he was suffering from asthma. And the man died. And when the whole issue happened, I mean, it's funny that social media and brush it off. Oba kaswaha, your nurses be your health facilities be some of these things need because of for some reasons into young body. Now to paying for they are in charge of these nurses anytime they are form I be expect say they have to punish them, they have to do what is needful. They are and I mean the cost because ekoya ko we say a simple yenimu bia yenkoye den yefa kotwere no. And even if say we complain we just leave it unattended. Niema bi say no ekwan ben so na yemfa so.
Okay, so I think personally our health is the most important thing. It is a oko baby are the most important thing ye bo ho ban na say wose ye fix it na ukọ na expectation na say standard na ye poor, then it means that obi be say we are all in time bomb. Because me am here ka say and then next me home for me I'll have to go to Kaswa Hospital or any hospital within Kaswa. Do you understand? Uko koduru onum na o ma handle you wu na abewu.
Yeah.
Meanwhile nka ye nyina ye boa ya tu ya no gu so na omo ye the right thing na wo ankasa na wo kasa na and I will defend no one day you'll be a victim.
Okay.
So I think what we need to do is, and I want to take it up to even the MCs, the MPs. You are not just political leaders.
Okay.
Our lives are very important.
Okay.
And now a lot of the complaints are more MP, MC you have to solve. No, one way or the other, SRBC help so.
Okay.
Because nipa na bridge I say flood, then nipa na pira, why you say. So the long and short is that let's help some of these media guys and then other people to kind of serve as an investigative cover.
Nice one.
Do you understand?
Nice one.
To bring out the problems there, then we all see how we can solve them. If people need to be transferred, transfer them. If you need to punish them, punish them.
Okay.
Because our lives is what they are playing with. I'm using playing in quote. I know they may also think, oh, okay, me so my yama from there and then no be crab say no be also a nurse pen I will nurse if we yes. My member, one of my teacher once says, so I'm an any amero on and one you good nurse. A china be or not a bad patient, a woman.
Sure.
So me betna na me baba defending na me. Some of us are doing very well, but others are also pulling us down.
Yep.
So let's all come together and make the agenda be like we want to fish out the wrong ones and get them off the system, or we retool or retrain them. Some of them need retraining. Okay, until maybe the assembly can even decide to partner with some of the media guys. You set out people to go around. Sometimes you can disguise yourself as a patient and go on some of these campaigns and bring out, so you call hospital and when some of us are medical people or health professionals, we can even be part of this team.
Okay, nice one.
You call, we bring out those kind of issues, then we see, okay, you're by a hospital, no, we sit with the management, you're by when evidence, okay, how do we make sure it doesn't happen again? Then we help those that need training. We put our hands together and train them. Those that need to be sacked, you sack them. You clear those garbage, because if we say we are resetting our country, then we have to reset everywhere. It shouldn't be baby near baby. So my brother, I think that should be it. Now they say complaining and I am it say media no so obi be say highway no so near the ombeba. How the number highway no so ono abedi akire.
Nice.
Ababe
Nice one for my boss Benke. He's the CEO, founder of Volunteers for Onua Wellness. It's an NGO focusing on some beboa na mapuchi about wellness and make sure say apum environment. I mean nimdia odi here yenya concerning about some of these things that they will propagate and help change the negative narrations in the economy. And he's a professional nurse and a health practitioner. Aside that, oyeni mabebre na memfa akonya we so membo na baso because obaka so ha odi wasi pim na obo ojuma is doing so many wonderful jobs. I mean almost all the cities, I mean towns, communities, villages, wakoho. And most of these things or in bottom seeker free. Oh, hear me. Now you're NGO, you want to partner. Looking forward to also collaborate. There's a time. I mean, the number will be on the screen. Call and have interaction. What I say. Okay, send baby concerning nurses. In as much as baby no Samsung your papa for nibi ha so the conversation isn't about say we're trying to tarnish your image, but it's about pointing the negative ones and using that medium to correct the narrative. Yeah, the good ones wouldn't be a bad influence. What's that say? Now let's talk about volunteers for Onua Wellness. How did the whole thing started? At what point now realizes I want to go into volunteerism, I want to do an NGO work. Me person me too Emma on mine na selflessly me kuma on mine.
Okay. Thank you, Kobe Josvan. So this volunteerism issue came in, as I said, it began long time when we started with the Knowledge is Power platform and doing other things. And I used to go to schools, churches, and things for health educations and other stuff. So, baby, by said we have to start this whole thing was ending of 2024.
Okay.
Yes, so ending of 2024, may imagine say, okay, why not do this thing more actively? Because it looked like I'm touching life, but I'm not really touching it as much as I want it. So it's not always that you have to wait for your country to do something for you.
Okay.
What can you also do for your country or your community? Because as we sit, we are sitting in a community.
Yeah.
And if this community, let's take it, if there was an outbreak of tuberculosis, I cannot come and sit here and be facing you and be talking like that.
Sure.
Meaning that every aspect of our life needs our contribution.
Okay.
It is a way of say the eco environment and I say community name found one. A yekesia a befa. Do you get it? So I decided I said no. Me de betna hospital. Na nipa ne bekwa yare. And I say or go through some problems. Now I feel wafaka ba hospital be di life so I spend 2 hours only in queue. Na ko ha ko lab, ko ha ko we. Why not look at the preventive part and then the supportive part? Say the be time and call the be develop condition na bo ho ka wasting the time no e dey problem na to our hospital no. You would have gone to the community level, then you help that person solve that problem at that stage. So in around December that mindset came. So we started operation in January.
Okay.
Our first event was 4th January at Adam Nana. That's the area I live. So yeah, so madam I go free.
Sure.
So I'm sure I the papa I was starting 50. Yeah, so we started with this free health screening outreaches. We instead of even sitting and say people should come, usually we move to houses. So
you go to the people.
Yes, we take it to the people because Ghana for your so them pa we any free no cry omra me no see me time. Meanwhile say I can't to what they be time and no duro. But you know, as much as I saw then we have to do more. So we take it to the people who do sanitation outreaches, clean up exercise, of which you've been there severally with us in our event. So this whole thing came in where we are looking at we will fix our community, we will fix our country. When our country and our communities are fixed, we are automatically fixed.
Sure.
Metie said my classmates they are outside the country because they feel say oh they need cash need there. But for me I think it's not all about money. Life is not all about money. Mpana say I should be healthy.
Okay.
Baby I'm a dimiti beto. They medi. They are Canadian. Obi be say they are not basic needs and they are not needs, they are wants. Sabi o say me wusi si a adaka de be si me kra no is smaller than my bed. My bed no cry me da so sisi no uko me fie o no ma ever say oba fie a we have a big compound me okay. But say uko sisi a you enter one room on that compound.
Sure.
When you enter that room you don't sleep in the whole room. You locate a small bed at a corner of the bed. Even on that small bed too as a particular line be small portion. You arrange yourself in there. So it means that the whole compound no cry na mansions na see we ya media car we ya one kasa original space na woman no is very small. No cars 10, no cars we okwata kan one seat so na atana. The rest of the seat no untimi nda so untimi nya so hwe. So we don't really need too much. I'm not saying Japadian, but no should not always be say at all costs and no me because fixing people's life or helping people for me I feel that is more of wealth than other things. Minya me pe but I think a honso so ehu hia me pa nti eno nti na matumi ho asi wo say yeso nimidia nyame de amaye ene nyame adom environment no experiences yenya school a yeso yetimi akọ ene ade no yeso yede beboa yeman ama yeman yetumpon.
Great one. I mean, adwuma wo ye no, nipa ho adwuma na wo ye.
Yeah.
It is very hard in Ghana to gather people and push a common go. How do you gather your people? Akwan ben so strategy ben na fast because obo ankofo ano so yanko ye adwuma we sebe hwe mpo enim no ehedin e wo Ghana. What do you know we anything?
Okay. So my brother Kobe, one thing I will tell you is human relationship is the most valuable currency.
Great one. Bas.
Human relationship
sure.
and also good relationship is the best currency any human being should have. So if you want to trade and your human relationship with people is positive, is good, sometimes you don't need physical money. Sabe obi won ma so no ntemu nya fan na se ombu onya no matter the amount of beka say je na beboa me ya de o betima ka say menko obi nsusu wo hono ma o ma one seed mpo so wa do sika ebe lorry fair akwa ya de na ma nipa o ma o sika kra aka say dabi. I remember one example recently screening bi wo Adam Nana for Father's Day no.
Okay.
Old soldiers no more was soldiers friend veterans more compound kese a more meeting or more canopies plastic chairs many omo kasa I see a person free screening near you know omo see yen use omo hono and we should use their resources omo chairs ni bibia electricity yen use omo in charge ye omo anso beba screening no so bi ye wie ya me send a letter of appreciation am me ska kakra kan so for maintenance at least eja kunya bibu a ana say electricity power me this scanner so but I guess I say as customary they say no, they will not take that money even though you use electricity, but they won't take the letter alone. Okay for them just because of the relationship I have with them. And omo ya make us here kwa ha no maba obi cry to me fee school. Some of our people are students.
Okay.
Omo to me fee omo school e try ticket back so just because we have an event. In this country because me is because of the relationship I have with them. Okay. So for me, relationship is something that I value a lot. My relationship with Obi, I don't joke with it. Until mostly when you offend me, I don't retaliate like that unless that thing is so dangerous. Okay. So I say, I need to retaliate and they are but I make sure I protect relationship and I value relationship and I always make sure say so they meet my year aboa no so I teach a lot. I do free teaching. Who call me drugstore here me whiteboard or no. I have students, they be a sonographers, or scan, they be a nurses, they be other medical professionals. They come. So they want you because of your experience teach them how to do this, how to do that. Marker, then we'll do it. Do you understand? I do it for free. Okay. It is any panel who he say on the screen. He sees it as an opportunity to also appreciate you.
And also learn.
Good, and also learn. And one good point, one at that time, so say, sir, volunteer activities now. I also use it as a platform for learning. Sure. So some of the nurses, some are students. Me ya na me de chiro so what do you say because if you are call hospital clinicals now. Nurse ni no new time or they chiro idea no. But when we go on outreaches, I'm able to use that opportunity to teach some of the nurses and health professionals on that. So also your volunteer team no and I say activity no. One of the objectives is also use it as a platform for learning or transfer of skill and knowledge. Into the Ebiama Obibia say everybody can join, not only the health professionals. Now we have people like Josvan who are in media. So maybe me person me should hire trap pictures and I take good shots. Josvan go camera no so much say. I remember one time you gave me some gist on phone. And now I one guy be a 30 minutes now so say who picture now. Josephine say, yeah, so me say, yeah, me shaking kwa ha, me. And one day he took a very nice picture, and myself, I loved it. Do you understand? That is a free knowledge. And if one day bet me abuano baby. So we are also looking at a woman no, a different professional background. We can also use it to train the younger ones need that opportunity. No? Then we also use it to connect people. A be a person who you may be by baby or through your volunteer team, no bet many baby affects no. Yeah, so it's a whole good feeling.
Yeah. All right. So is it registered? And so Ubi person will join Akunya Benso and a bit me joining.
Great. Yes. So currently, Volunteers for Unia Wellness VOW is officially registered
Nice one.
with the Registrar General. It's registered. So now, who be any and young quanche for Kobo Bia na yeah. Nti say person will join here. As I said, it doesn't matter your background. The only qualification is good heart.
Okay.
And then dedication. Qualification in here, no. Education background and kahun. Profession and kahun. Age kura and kahun. Oye ulumayo, oye denyo. You can, as we said, we have engineers. Last one engineer, I don't have his permission to mention his name, so I don't want to mention names out of respect, because we'll be on pair say BSA. But I have an engineer who called, who is in the water company, Ghana Water Company. Say, opeso obe join here. And this will be an near fee papa penny, as you see, wababe kanya ho. Ne say, or also the nim dear, and then the profession bellboys will be pursued sooner bibia. And I say, Sebi on draw no could be bit many juma. Or Ghana Water Company, and I say any other area of work. So we are open to everybody. Two person join here on Facebook, no. You can see some of our activity on Facebook. Dean or Volunteers for Wellness.
Okay.
Volunteers for Wellness by Dean officially near Volunteers for Unia Wellness VOW. But on Facebook is Volunteers for Wellness. And then your telephone number, so a bit in there, share your answer near Casa 02499 76159. 02499 76159. So we are open, and there were a lot of projects you're working on. So your penipa bebre mumrambe join here so that we can make the impact. If say you be who TV so and say community mu and other community say also who ye bibi at the aboa community and say ewiase say the be anyame e bi hira ye kase nyame hira na mani pa ye defo obredwuma de emfa bi nka ho.
Okay, so far so good. Yeah. What do you have fame? So be person joining a kwenye obe fast so and some of the things ni be moving forward here. Now, let's talk about some of the projects ni be awaye. Be at Volunteers for Unia Wellness. Office be a morning nam and moye de mo pe. Walk us through some of the projects ni be awaye. Ya obi so a onim no at the end of the day. But we say no, it's not like just fans na moji, but my niyema and amugusunsu njuma.
Yes. Great. Medase Kobe Josvan and then the Josvan Media Group. So as I said, yes, here in January till June. The last count of our records, we've been engaged in 24 activities.
Wow.
And out of the 24 activities, health screenings, baby, after health screenings, Obaka so a new market, screening, or Adam Nana, screening 3 times. Adam Nana, and then other communities in so you screening, even Akraman, for us saying on the Cape Coast Road, Ultra Liberia camp, Yakoho acquire screenings, side one for sorry, Presby Church, Kasua Presby Church, as we've done like 2 times there, and other churches and so Yakoho no Marco acquire screenings and more. Bano sanitation, health, your friends saying. Clean up like gutter, desilting. Ya be or Adam Nana stretch, Sao Boom Road, so ya be or New Market side honum. Your friend is saying Market Junction side honum, so ya clean up exercises honum. So aside that, and so health educations, we go to radio stations to do so in Kasua. We've been to some radio stations in some of the Kasua municipality. and I yakoko some we've got invitation to some churches and other organized groups to come and educate on into some of the youth group. I remember some time ago the youth wing of the Presby Church and invited me to talk about STIs, sexually transmitted infections.
Good.
And in fact, I hear a lot of education. Education, the P. I could some television stations, even Onua TV, any Onua FM. Also, a program be or Kaswa and the bridge. I friend or Onua Pomdi Keteke. Omone collaborate. Sa Jumadi, and we've been on the Onua TV and I call an interview there when they were doing this their Salafest.
Okay.
Now it's about sanitation and some health education activities and so on. So we've been engaged in a lot of health related activities. Nyamiadom aye bebre meka say enye nyina kra na uhu media no so because so you started your strategy and say the first 6 months no we're going to do it low tone.
Okay.
Na yempese be ni gidigidi bia na ye de test your pulse ehun say ye wo ahoden no and do we have young men and women who are still willing to sacrifice for their country. And I must say it's true. We still have young men and women are more motivated, said they will do things for their community and country. And one is you yourself. Yeah.
All right, you are doing amazing, and I think we here say you share the platform the video watching here. But I wish for say we a young guy now, open say we join Unia volunteers for Unia wellness. I think this is the right family to join. I mean. Personally, I'm a member,
yes,
full-time member. But yes, and you may be a course to be if you want all the updates, you go through my pages, and I've vowed say all the time, Nina, and so you see a platform there. Now, Obi Baby say, is your NGO, is your foundation politically motivated? Say a political party be and Kofubita China low key, Mupian say this Jumai.
Okay, thank you so much. So, Omo Motechina. Me and volunteers na ya who show mo ye adwuma na I know Joseph now we don't affiliate or we are not sanctioned by any political party.
Okay.
Let me make it categorically clear. Said this organization or volunteer group is not politically sanctioned, which means it's not a wing of any political party. The political party we belong to is the community. Okay. So community is a political party. Nice. So please, or background, whether we party, we need party be come and join us. Do you understand? Let's work. You see, when a problem is coming, it doesn't come and ask for a political affiliation.
Okay.
COVID by or my lockdown. Party ben for nana a wabonting. Obiani, you can't you do you get it? Owo tisi krom has isi ya. Mebusa say offer. Which party are you? Oka say A as oko, B as o near macho. No. So it means that health and this kind of development and things is not party related.
Okay.
And one thing I tell my volunteers is that when you join as a volunteer for our party, Samotonchain.
Nice one.
Say do time I hear to about mo politics. You're too abandoned, whoever won. Let's all come together and move on.
Nice one.
Do you understand?
To those people now more think say be a party beta chi now ye baby chali ye be sani. Aha. Who party A, B up to Z. Bra.
Yes.
On mine no hondo any here. Now moving forward, there be a project be either one name. They had me and share name. Use this medium your time na
Okay, so thank you very much. So through Josvan Media and copy Josvan TV name as a four. The person here can say we've got into another phase.
Okay.
And no, we are going to do more of working on the mindsets and then the behavior of people. And our target group is the next generation.
Great.
And this next generation has got, so we are targeting junior high schools, senior high schools, and some areas of the tertiary, some other groups. Because you say your problem about your mindset and how we were brought up.
Yeah.
Okay. Uko broni kroma, you don't misbehave there because Okwa omo ankasa na akro ni omo they are not misbehaving.
Sure.
They are not throwing things anyhow. They are keeping everything in order. So okwa automatically you also behave. Yeah. Nti na chese yen so ya system no si yetimi bring it up a generation a omo ye well behaved, very neat, keep things well, keep the community clean and other things are secured. Obi nso fi baabi a eye hoye disorderly na obeto ye die nimu a obi say no aha ye means amfun aha. We don't do things anyhow. They will also behave. So you go and do cleanup exercise, the next 2 days, 3 days you go, the place is filthy again. But yeah, say we are going to work on behavior change and then the mindset. So now the next phase of volunteers for New Wellness is you'll be seeing us with groups. So we'll be coming to churches, we'll be coming to schools, organization, companies to engage in certain campaigns. So now I want to go on a campaign we're calling the Citizen 101 campaign.
Great one.
Citizen 101. Most of our when we go to the university or this, you see that a course, a first course you take, say maybe Science 101 and Anatomy 101, meaning that that is the basics or the foundation of that course. So we also want to build the foundation of our community, our citizens. We want to bring a new set of citizens, okay, responsible citizens. So that campaign is going to be called the Citizen 101 campaign. And thankfully, we are not just going to be talking anyhow. We have developed a manual we call the Citizen 101 handbook.
Great one.
Citizen 101 handbook. We are trying to see if we'll get some sponsors to help us print more so that we can even dash it out free to our children, adults, everyone. So the bear guide ama ubia. And in this handbook, we have a lot of things. So we have things like how to stop drug abuse, violent behaviors, maintenance culture, protection of public property, how to keep your dignity or trying to protect our community, sanitation, protection of gender, and then gender equalities, civic education, leadership. We're also looking at things like self-reliance, how to be self-reliant so that you don't rely on people, financial, freedom. So we are looking at building
All
people,
aspects.
do you understand, all aspects, so that at the end of the day, we have brought up a complete responsible Ghanaian.
Great.
So that they are on mind by the
I think so with that handbook now come assembly.
Yeah.
Say, are you ready? We need to sit and
Yes.
have a convo about it. We talk vividly
Yeah.
about it. So
Yeah.
we'll leave it to another segment. But we for he is the CEO of Volunteers for New Wellness. They are doing extremely amazing and when he said that's nothing now you're taking a true journey in your life journey. I mean foundation and the way Shasi and Yemani be a more yeah, Chinabi, what is a international organization be a partner na on it won't be a surprise because he started from somewhere and he has gotten to where he is now. Now, we'll final words. So be wabonting message be an apostle the man. You see this medium. I mean 2 minutes and then monitor now. Yes, sir.
Yes, thank you. So Ben Kerr, as the leader of the Volunteers for New Wellness, my final word I may catch is first of all, make that your volunteers because whatever we do is through them. And I intro biaka so you could tell the say omode ahwade na omode shem no nyame ene be hira yina. Now the other thing is say we encourage wonso so a wote ho say obe den obe join here. Obi to no onye adwuma. These are some of the productive things or the hu shema and no crab man of forward thinking mentality. Na no so atimi asa man opportunity bi akina bi. So and we'll also reach out to companies, organizations, other NGOs that we are open for partnership. Through your next phase, the Citizen 101 campaign, we have a lot of projects in. Plenty projects. So you can come, we sit down, anywhere who area, ubet me a partner and as a sponsor, then you look at that one and go ahead. Then we also want to tell people, say, one kasawa brabono. Your whole responsibility.
Great one.
Your life is your own responsibility. Don't live your life that may try and say MC bebabe way and I MP anyway. One kasano, what have you done about that situation? So before say obeka say abayin me way MC beboa ye we no mo ankasa amoti area mo ho no den na moye afa problem no ho so at I say so let's all come together as a country. This country, we have a bright future and we are very rich. If we do our things well, life will be comfortable for all of us. You don't need to go and queue some me visa me then abroche na ho an ha na unwuzi abrofo ni mi nso ba ha aha ye hell as ngomba. So it means that there's something good here.
Sure.
But sometimes how I bear handle niema no and em man nko ye maya nti fa won to ma be volunteers for Onua Wellness ano na yen partner na yen make sure say we will live a country that is very, very good for ourselves, our children, and the generation unborn. I thank you. I thank every follower of Josvan Media, Kobe Josvan's channels. They are doing so well. And men can say, be a Kobe Josvan, a member of the volunteer for Onua Wellness. But I knew his channel, I knew his content even before I reached out to him. So it's not through volunteers for Onua Wellness. He's doing great things, and I'll advise let's all come together and support this channel. This is one of the very, very important and very educative channels. And I, Ben Care, I am pledging that anytime I have to come and support Kobe Josvan Media, avail myself for anything, we are available. So also come, join them, subscribe. Any content they put, like it, comment, share it, so that this platform will be an international and be a household channel. Thank you, Kobe Josvan, and thank you, Ghana.
Thank you so much, CEO of Volunteers for Onua Wellness. He's doing extremely amazing, and me, and you'll be an sabi medimento abonediano. I mean, before I say me person be found yanko no na me hu bibi papa ewo mu and in as much as say obono homodin na bra bon so eye ade a ya mu bi yinyaya anka. I mean, able to achieve any success maybe. Nyame ehira no, but he's very humble, very respectful, and one thing I've always loved about him say odi obu ema obia. And you obia na etisa. And for you to meet someone like this, anadwumudo or sanso ewo nimdie. Abrena nyina de owo no no obe person no obe share no. Could see say that person is very positive and or you be on your selfish. So Abusha, he is the CEO and wakasa bebre. O person will join association no akonya ewo ha. Bra bekan ho ne nyina yempushi a positive agenda no. Numbers no ego screen so call join but on all social media platforms kai say obe share na we follow na wodi wani so adi njuma pani bia de bo midin e de Kobe Josvan na me blogger social influencer and the pundit na social mo ewo highway no so a bit for me the nation's blogger or the ugly village boy Macron. Bye bye.